Good morning, everybody. Thanks for your patience here. The House Government Operations Committee for February 9th, 2026 is called to order. Clerk, please open the board to take the roll. And members, if you haven't already signed in on your machine. I'm sorry, if everybody's punched in, clerk, if you want to take the...
Mr. Chairman, you have 13 members present. You have a quorum.
Thank you for that. Before we begin with business, are there any personal orders or comments? We've got one. Chairman Reedy, you're recognized.
Thank you, Mr. Chairman. And Mr. Chairman, I would like to introduce my intern for this year, William Bunce. William, if you'd stand up. Vanderbilt student working on his Master of Public Health, and I look forward to seeing what kind of public health policy he gets to us in the future. Let's make him welcome.
Thank you for that. Members, anyone else? All right, not seeing anybody. Oh, Representative Hardaway, my bad.
Thank you, Chairman. I was trying to resist, but how about them Seahawks?
Kind of rooting for Coach Vrabel personally, but okay. All right, next up, first item on our agenda, House Bill 484 by Representative Martin.
Motion.
We have motion and a second. You are recognized when you're ready, sir.
Thank you, committee and chair. Every one of us have been impacted directly by cancer and the cost and the barriers that come along with that at times. And this specific bill aims to get patients the care they need exactly when they need it without the barriers that we're currently seeing. What this bill would do would ensure that biomarker testing would be covered when ordered by a provider that is meeting medical necessity and what the doctor perceives to be the right treatment at that time. This bill does not include screenings. Other bills like this have passed in Oklahoma and Texas and Florida. And so what we're trying to do is help get rid of some of that component of that barrier that we're seeing. 21 survey from oncologists said that nearly 66% of their cases are seeing barriers due to the restraint of not having some of these services covered. So with that, I have an individual here that would like to speak, if you guys wouldn't mind hearing from our specialist.
We can do that. Catch up on my notes. We're going to go out of session here for just a minute to have David Charles. Dr. David Charles, are you here? If you would, please come on up. We're going to go out of session. Just make yourself comfortable at one of the microphones there in front of you. Sure, that'd be great. And if you would, please introduce yourself. Let us know who you're with, and we'll give you 3 minutes to go over your purpose for being here today.
All right. So thank you, Chairman Lafferty, for hosting me. So my name is David Charles. I'm a neurologist at Vanderbilt University, obviously here in Nashville. Today, I'm speaking on behalf of the Alliance for Patient Access, which is a nonprofit, been around for about 20 years that advocates for patients to have access to approved therapy. So I'm here rising in support of House Bill 484. So biomarker testing, as a physician, is when you take blood or some tissue samples, something, send it for test to see if you can identify abnormal genes or abnormal proteins that might tell you how that certain disease is either going to respond to treatment or how it might progress over time. And so biomarker testing enables clinicians like myself to improve the accuracy of the diagnosis, to then select the right treatment, which is key, and then how you manage the disease going forward. So a couple of examples. For cancer, which Representative Martin already mentioned, in cancer therapy, right, if you have biomarker testing that tells you what the right therapy is, right, then you have the best chance to help the person or stop the progression of the cancer. If you don't have that biomarker testing, it's kind of like guess and check. Right? And in cancer, when you're guessing and checking, the check is waiting on it to progress. The treatment's not working. Plus, you're spending dollars that aren't helpful to the patient. So in cancer, it's key. In rheumatology, a biomarker can tell you, again, which medications are unlikely to work for the rheumatologic condition the person has. And in my field, in neurology, right, Alzheimer's disease. We can now test people for early changes in Alzheimer's disease, and we have treatment. for Alzheimer's now, but many patients can't get access. So I'll tell a personal story. I have to have a biopsy. My doctor tells me that there's some genetic testing that can be done that'll tell us about your kids and help us decide what treatment is right for you if it's positive. And she said, but it's $3,000 out of pocket. Insurance doesn't cover it. Every day I go to clinic, I see a dozen patients. Most all of them cannot afford a $3,000 out of pocket to get that. I can afford it, but most people can't, right? So that's where we are. So 484 would get Tennesseans the right care quicker, the best treatment outcomes, and in essence, save dollars. So we wouldn't be spending on things that we later, or we could know, not going to help the patient. So there are guardrails in place. It's got to be an FDA-approved biomarker, Medicare policy, something like that. So it's not just anything the practitioner wants to order. It has to be evidence-based, based on practice guidelines and such. And so I'll close with this. I love quotes. Thomas Jefferson said, laws and institutions must go hand in hand with the progress of the human mind. All right, 484 does exactly that. We're making so much progress in biomarkers. Laws and institutions have to keep up. Right? Patients need access to biomarkers. Thank you.
Thank you for that presentation. Very informative, very compressed. We appreciate that. Representative Hardaway, you're recognized, sir.
Thank you, Mr. Chairman, and thank you, Doctor, for your presentation. You touched on it, but could you just lay out side by side? You may have the economics of it at hand, maybe you don't, but the pure economic costs of that goes along with early detection and the actual cost of treating the early stages of any of these diseases versus when they get to the more severe stages.
Well, I don't have dollars. I don't have a report to share with you, but I'm sure that maybe Representative Martin or others could testify to the finances around it. But I can share with you what it's like to be a clinician, taking care of someone who's getting a diagnosis. And if I could know for sure what their diagnosis was, or more importantly, what their diagnosis is not, that allows me to select the right therapy. So, you know, it's an axiom in medicine. Early diagnosis and early treatment gets you the best outcomes, right? In cancer care, everyone knows that. And so we have to be able to utilize the progress that we're making in biomarkers to advance healthcare. At the end of the day, it's the right care for the right patient at the right time, and it saves the healthcare system dollars.
And would you agree that as we use AI to kind of assist you going forward, that this will help us to manage healthcare costs overall, not just being more effective in the treatment of the disease, but also in the efficiencies?
So my personal opinion on artificial intelligence is this. It is a tool that healthcare providers are going to use just like the surgeon uses a scalpel, just like the anesthesiologist uses anesthesia, right? Those two things, anesthesia and surgical instruments, revolutionized the surgical treatment of care, but they're all tools that the clinician, the surgeon uses. AI will be the same. AI is not going to replace physicians. AI is not going to touch you and examine you, but it's going to be a tool that can be properly used. And unfortunately, it could be misused, but it'll be a tool that will, in my personal opinion, revolutionize healthcare for the better.
Thank you, sir. And you couldn't end it with a better phrase. Thank you, Chairman.
Thank you. Representative Fritz, you're recognized.
Thank you, Mr. Chairman. Thank you, Doctor, for your time. Just have one quick question for you. I met with some of the Alzheimer's folks last week and big advocates for this. I lost a mother to Alzheimer's dementia. If we could pre-diagnose and provide help and better quality of life, I agree with your Jefferson quote. I only have this one concern. In F section of both bills, it talks about an exception to coverage policy. And so as someone who's grown distrustful of insurance companies over the last few years, but and I can offer it to the sponsor as well, but do we have concerns that by taking this information, we might find ourselves canceling health insurance policies once that information is shared by the providers who fund that $3,000 test. And so that's my big concern with it.
So I understand the concern. Health insurers increasingly are using various utilization management barriers, right? One of them, well, let's talk about drugs, because you could kind of use that as a parallel, as an analogy. One strategy, to make a patient switch to a cheaper drug could be more profitable for the insurance company to get the patient on a different drug, is to use a higher copay. We still cover your drug, but your out-of-pocket is going to be $100 a month instead of $20 a month. Your choice. You pick. Same thing could be done in biomarker testing, but increasingly now, insurers are just taking a drug completely off formulary. If you want that drug, you got to buy it out of pocket. Here are the drugs we have for whatever condition. Could insurers do that with biomarker testing?
Follow up.
Thank you, doctor. And my follow-up's actually more than just the cost of the drug and the copay. It is, could that information be shared with other carriers so that things like
I'm sorry, miss.
life insurance and auto insurance could be impacted by a biomarker that comes back and says that Monty Fritz has a genetic tendency to have these problems later in life? So that was my concern. That's my big concern about.
So this is an area I don't have expertise, but I believe that there is even federal legislation, federal law or regulations that monitor this, that health insurers, can't not cover you for pre-existing illness any longer. And I don't believe life insurance companies can use, they can't force you to take a genetic test and say, we see this, so we're not going to cover you. That's not my area of expertise.
Thank you, Mr. Chairman.
Thank you. Members, do we have any other questions at this time? Seeing none. We have a question on the bill. We're going to go. Members, bear with us, or just a few minutes, okay? We'll be right back. All right, members, audience, thanks for your patience. Thank you, Dr. Charles, for your testimony. We didn't have any more questions, so thank you. We appreciate you being here today. We're back in session. Representative Martin, you're recognized, sir.
Thank you. Thank you for that great explanation. We're going to make one change on it into finance before it goes there on the date component of it. So we're going to work on that aspect if the committee allows to move through this one. But I stand ready for any other questions.
Representative Clemens, you're recognized, sir.
Thank you, Mr. Chairman, and thank you for this legislation. This is really important. My question was concerning some of the amended language, which I think this bill's before us as amended. Is that correct?
Yes, sir.
So I have real problems with this prior authorization types requirements. And I know that that was put back in the legislation, but am I correct that there were timelines also put in the amendment, or are those timelines not in this amended version? And I'm regarding the 72-hour and 24-hour for non-urgent versus urgent. Is that language, I just want to confirm that that's still in there, because these prior
Yeah, come
authorizations
through.
by
Yes, sir.
insurance
That should
companies
still
are
be in.
problematic.
That should still be in there. Yes, sir.
Is it in there? Well, I asked that because I didn't see it in the one online, and it was in the summary of barcode 5211. And so I was trying to ensure that. And
Yes.
if it's not in there, I would like to see it added
Add it
at some
back in.
point. I don't want to hold this thing up. I want this
No,
to
you're
get
good. Yes, sir.
passed as soon as possible.
So that portion goes back to accordance with state law, the 24 and 72-hour one. Was what the
That's-
amendment did. Yeah.
That's the reference to state law.
Yep.
Thank
Yes,
you. I
sir.
appreciate that
No, yeah,
clarification.
thank you. Yes, sir.
All right, glad we were able to get that cleared up. Members, any more questions?
Keeping you on your feet on a Monday.
Representative Fritz, you're recognized, sir.
Thank you, Mr. Chairman. Thank you, sponsor, for the bill. I'm fully in supportive of it. This may be a question for you. It's kind of what I asked the subject matter expert. So in F section of the bill, if I'm looking at the correct language, it says a convenient process to request an exception to a coverage policy or an adverse utilization review determination of a health insurer. And so I'm not sure that I fully understand in all legal terms what that means. Does that give the consumer, in this case, protection against the information gained in the testing from being shared widely so that that consumer might be harmed in either life insurance, any other, end of life care type of insurance, any of the other insurance products that are on the market? I know that insurance companies are looking to reduce risk, as all of our businesses do, right? And so I just want to make sure we've got enough concern with the consumer in here that we don't put them at risk as the insurance companies attempt to reduce risk.
Yes, sir.
Sponsor, you're recognized.
Thank you, Chairman, and thank you, Representative, for that question. The best thing I got for you on that aspect is federal law component against discrimination based upon their health status. So that's still there from the federal side, and hopefully would be there in protection of that component of it. Based on premiums and everything of that magnitude, so their data should be protected as well.
Thank you.
All right, thank you for that. I believe that would conclude the questioning. I don't see anybody else on my list. Everybody's looking good. Okay. Chairman Faison, you want to renew? Question, we have a question on the bill? Do I have a second? And we have a second. All right, Mr. Clerk, open the board, please. Members, place your vote. Mr. Clerk, take the vote.
Mr. Chairman, you have 15 ayes and 0 nays.
Thank you very much for that. Bill will move out to Finance, Ways and Means. Thank you, sponsor.
Thank you, committee and chair, and let me keep you on your toes on a Monday. Appreciate it. Thank you all.
All right. The remaining bills on this calendar are going to be mine, so we're going to hand the gavel off to Chairman Reedy.
Thank you, Mr. Chairman. We have 6 more bills on this calendar. Committee members, ask as many questions as you would like, but we're at a hard stop at 12 o'clock, which means we'll roll the remainder of the calendar to next week. Mr. Chairman, you're recognized on item number 2, House Bill 1573, Department of Aging and Disability.
Thank you, Chairman. Members, this bill extends the Department of Aging and Disability until 2028. They had their sunset hearing on June 18th of 2025, where the question and answer was
We have a
reviewed.
motion
Oh.
and a second. Please continue, sir.
Thank you, Chairman. We did have the Q&A. It was reviewed and a 2-year recommendation was given. We do have representatives of the department here with us if members have any questions for them. Otherwise, I will try and take any questions you might have and ask for your support on the bill.
Members, question on the bill? Question's been called. Clerk, please open the board for the vote. Clerk, please take the vote.
Mr. Chairman, you have 14 ayes and 0 nays.
Thank you very much. Bill moves out to calendar and rules. Item number 3 on your calendar, House Bill 1574, Department of General Services. Chairman Lafferty, you are recognized on your bill. I got a motion and a second.
Thank you, Chairman. Members, this bill extends the Department of General Services until 2030. They've had their sunset hearing on December 7th of 25. I'm sorry, December 17th of 25, where an audit was reviewed and this 4-year recommendation was given. There were no findings in the audit, but there were 2 observations and 1 emerging issue. Again, we do have representatives from the department here today if the members would like to go out of session and ask any questions. Otherwise, I'd like to go ahead and ask for your support.
Thank you, Mr. Chairman. Any questions for the chairman on the bill? Seeing none, are we ready to vote? Clerk, please open the board for the vote. Clerk, please take the vote. There we go.
Mr. Chairman, you have 13 ayes and 0 nays.
We need to add the chairman's vote as aye. He didn't hit the button in time or something happened.
I missed it twice.
Bill moves out to calendar and rules. Committee members, we're on item 4, House Bill 1574, Department of Labor and Workforce Development. I've got a motion and a second. Chairman Lafferty, you're recognized on the bill.
Thank you, Chairman. Member, this bill extends the Department of Labor and Workforce Development to 2030. They had their sunset hearing on August the 20th of 2025, where an audit was reviewed and a 4-year recommendation given. There were no findings or observations in the audit. We have representatives from the department here if members wish to go out of session to hear from them.
1 minute, Chairman. I need to make a correction. That's House Bill 1576. Chairman Clemens, you're recognized.
I was going to ask a question of the department if they're available.
Yes, they are available. Would you like for them to come forward?
Yes, please.
So at this time, we'll go out of session to hear from the department. Thank you for being with us today. Please recognize yourselves for the record.
Good morning, Mr. Chairman, members of the committee. My name is Denise Thomas, Commissioner for the Tennessee Department of Labor and Workforce Development.
Thank you. With that, please continue. Chairman Clemens, go ahead and ask your question.
Thank you, Mr. Chairman. And I just have 3 brief questions. One, reading the economic report to the governor from the Boyd Center at University of Tennessee in Knoxville, has been pretty alarming information in there concerning the softness of our labor market and what the trends are looking like for our labor market. Can you speak to that at this time? I know that there are different variables creating not only job attainment, but also job participation in the state of Tennessee. Can you speak to those just briefly for us?
Yes, thank you for the question. There are some variables, specifically as it depends on certain industry sectors. What we're seeing globally in the market right now, whereas Tennessee has seen an increase in labor force participation, which is really good, we are seeing some minor disruption around AI early. It doesn't necessarily mean that jobs are going away. It means it's creating new jobs or creating efficiencies, and so companies are adjusting. So we are seeing some layoffs in Tennessee, not different than where we're seeing it across the country. I think the challenge for us is to make sure that as we see this specific to certain industries, that we are identifying and creating space for training opportunities to solidify individuals in the jobs to mitigate job loss. It'll be a little bit of a roller coaster as we see AI continue to develop, and also the new sets of skills that will be determined. But overall, we have seen our labor force participation increase, which is a good sign for us here in Tennessee.
Thank you. And some of the trends about that were a little concerning to me, but some of the job participation data variables, which you didn't mention, were college attainment rates and health outcomes across the state of Tennessee. And I know your department doesn't necessarily directly work on those issues, but is there interdepartmental coordination and work being done to address those two variables specifically?
So on the health outcomes, we are part of a livability collaborative with the Tennessee Department of Health, which really just brings in employment as obviously a sustainer for individuals so they could work and take care of themselves. That helps with overall living for an individual. But on the interagency collaboration, we are part of TN Works, which is 6 agencies that are included in that. And I think what's happening here is it's streamlining a framework that we can actually work on workforce development issues together and not in silos. So it's not just identifying which training skills are needed, but it's close coordination with the Tennessee Board of Regents and THEC and others to make sure that our resources are also being provided to individuals to get the training they need to enter the labor market. So the interagency is as strong as it's been in Tennessee for a very long time.
Thank you for that. And just 2 other questions, one of which is if you could speak to the fiscal integrity of the Unemployment Trust Fund. And then also with regards to the layoffs that have been taking place, has the department been receiving due legal notice from the corporations that are laying off individuals as required by law?
Yes, we have been receiving warn notices. Not only are we receiving the warn notices and distributing those, we also have moved into a posture the last couple of years that when we see layoffs happening, that we immediately go into action to try to get those individuals connected with other employment. And so before, this was primarily, just whether or not they had performed their legal duties and we would record it. Now we're using that data to say if another company is laying off, there are obviously labor deficits for another. And so we have teams now, which is what we call our rapid response team that goes to work and work with the company to get those individuals placed. And so we're not having any issues as far as compliance, but we are seeing this as an indicator to get the market turned over quickly so we can mitigate any other further layoffs.
And before you respond to my question about the integrity of the Unemployment Trust Fund, have there been any corporations that have failed to provide notice?
I'm not aware of that. We can certainly go back and look at that, but I'm not aware of any that have failed to meet the obligation.
And what about the fund?
For the trust fund, we're at 1.5 billion. 101 million was added in 2025. And I believe the interest is around 40 million. Is that correct? I'm looking to my CFO, Andy Summer. 49 million. Thank you.
Thank you for that. Thank you, Mr. Chairman.
Thank you. That's Representative Fritz, please.
Thank you, Mr. Chairman. Thank you all for your work. I have just a general question. I've gotten some calls of concern regarding labor market in my district in the energy sector, that some of the members that have worked for me or I've managed or supervised over the years past in Knoxville, Atomic Trades and Labor Council, questioning the possibility of illegals working on some of the energy jobs in Oak Ridge. Have you heard any reports about those?
We have not, but I will tell you there's broader concerns about the energy sector and workforce development. So we've been meeting with individuals in and around Knoxville, Oak Ridge, and other communities to make sure that we're brought in on a broader workforce strategy. We understand that not everyone needed for the nuclear sector is going to be scientists. Some of them will be tradesmen. And so for us, we want to identify where the potential lies all across our state. We know we can't just do this alone in Knoxville and Oak Ridge. So we got to make sure there's energy and training opportunities all across our state. So we've been brought in working with great folks like ETech and others and TN Squared. So we're at the table working in coordination with those individuals on the ground. We want to make sure that we also broaden the scope when it comes to where training programs are established. Right now, we know it's heavy around East. So we're working with our partners going back to our TN Works multi-agency collaborative to be able to do that. But as far as illegals, we have not heard that, but we are keeping a close eye on the market.
Representative Fritz.
Thank you, Mr. Chairman. Just quickly, I'll get you the contact information for Knoxville Building Trades because I think they'll want to have that conversation with you.
Thank you. We're happy to follow up with them.
Thank you so much.
Thank you.
Thank you. Any further questions for Commissioner Thomas or staff? Representative Hardaway.
Thank you, Chairman. And good morning to you, ma'am.
Good morning, sir.
Are you a part of the state AI task force?
So I'm actually on the AI Advisory Committee for the state of Tennessee.
And y'all meet how often?
We meet monthly.
And are there reports generated from each meeting?
There are some reports. We're looking now primarily, I'm a part of a group that looks at AI use cases for state agencies. I know they're working on a broader scope, and there was an AI conference that was rescheduled because of the weather to bring in experts and have some early sort of assessments of what they found in the market. I'm also a part of several national organizations that's working on AI around workforce development. Of course, not all of it is directly indicative of what's happening in Tennessee, but we are aware of some of the changes that are happening across the country.
And do y'all have strategies for the different geographic regions?
We're working on it. I will not say as I sit here that we figured it all out, because it's changing and advancing at such a rate that we'll make sure. And I think some of this is our biggest concern is what's immediately in front of us, and then how do we make sure we're identifying and training for skills that are yet to be developed. As I mentioned before, some of the components around AI, some of the industries haven't identified it yet at the acceleration pace that it's on. So we're trying to make sure that we do things like influence competencies that's cross-cutting, meaning that it's not so specific to one particular occupational sector, that there's no transferability if that job market were to shift. And so I would certainly say listening to experts and being in rooms. I don't think anybody has it defined yet, but are we at the table and working on it? Yes, sir. But it is something that we have to stay on top of.
And are your meetings publicized and open to the public?
The ones we have on the advisory council are not. I think the larger scope meetings for AI use cases for the state may be. I'm not exactly sure on that, but we can certainly get you that information.
Would there be a reason for those, any of those meetings not to be?
I am not sure about that. I know the ones that we, again, the committee I'm on is just isolated to use cases for agencies that are wanting to adopt AI technology. The ones that are on the broader scope, again, around how AI can be used in policies and procedures for the state, I'm not aware of, but we could certainly ask that question.
Okay, because I just don't see how we develop policy without the public input. When we're looking at the archives, are your minutes made available to the public?
I can find that information out for you, sir. Again, ours are restricted to just the adoption of AI technology for agencies, not necessarily the broader technology for citizens.
All right. Mr. Chairman, I'm concerned that we're letting some of these formalities get in the way of us being effective in generating not just tactics, but a strategic plan for the state in dealing with AI, both in the private sector and in government, local, meaning city, county, and state, and the interactions with the feds. So I would ask, Madam Commissioner, if you would get that information to our chairman so he can distribute it to the rest of the committee.
We'll make sure we do that. I do want to add just briefly before we leave the comment is the State Workforce Development Board, which comprises not just members of some of the state agencies, but it's a private sector-led board, has adopted AI as a framework and a priority. And we're in the process of commissioning a study. That information is very public for anyone who would like to take part in the State Workforce Board meetings, and their findings will be published as well, not just on our website, but also on the State Workforce Board's website. So that is information, and that is an approach that our department has taken to make sure that we're looking at broader AI use cases, and we've been partnering with universities. So that work is continuing. We can certainly make that available as well.
Thank you,
All
Commissioner
right.
Thomas.
Thank you, ma'am. Thank you, Chairman.
Yes, sir. Any further questions for Commissioner Thomas or her staff? Seeing none. With that, thank you for being with us today and that information. We'll go back into session. Any further questions for the chairman on this piece of legislation? Seeing none. Clerk, please open the board for the vote. If everyone would cast their vote. Anyone like to change their vote? Seeing none. Clerk, please take the vote.
Mr. Chairman, you have 14 ayes and 0 nays.
Thank you. Bill moves out to calendar and rules. Next on the calendar, item number 5, House Bill 1577, Department of Tourist Development. Chairman Lafferty, you are recognized. We've got a motion. Second. And a second on the bill.
Thank you, Chairman. Members, this bill extends the Department of Tourist Development until 2030. They had their sunset hearing on August the 20th of 2025, where an audit was reviewed and this 4-year recommendation was given. They had no findings or observations in their audit, and we do have representatives here if members wish to go out of session. Otherwise, I ask for your support.
Thank you, Mr. Chairman. Questions, comments for the chairman on the bill? Representative Hardaway.
For out of session from the department, sir.
Got a motion to go out of session. Do so at this time. Commissioner Ezell, please come forward and recognize yourself for the record.
I'm Mark Ezell. I'm Commissioner, Department of Tennessee Development, Tourist Development for Tennessee.
Commissioner, it's always good to see you.
Yes, sir.
Representative Hardaway, your question, please.
Thank you, Chairman. And as he said, it's always good to see you. I'd like to see more of you on my home turf. Are you supporting any of the major venues that we have for sports?
Yes, sir, we are. Good question. We support both the Liberty Bowl and we also support Southern Heritage Classic as 2 of the major sports pieces. Our team just got back from Berlin, where we were able to support in London and Berlin, the Grizzlies, with their first venture into the international piece. So we're in Memphis regularly working on various things. We're excited about this upcoming year. Last year we had BB King's birthday that we got to spend a lot of time and money celebrating. This year will be about our arts with the new art museum, the metal arts also. So we're really excited about the cultural pieces that happen in Memphis, and then we've always got their music, outdoors, and culinary. We have a new culinary program that debuts tonight that features Boo Mitchell and DJ Paul and a bunch of others.
Representative Hardaway.
I know I shouldn't, but I got to ask what that looks like. Culinary program.
Yes, sir. So what we've been able to do is, and you'll hear later potentially in our budget hearing, but we've added the 5th pillar of culinary because our restaurant business is so important in attracting tourists. Last year, we were able to partner with 5 other states and be able to bring Michelin, the true international brand, to Tennessee. That led to us having 36 restaurants that are named throughout the state of Tennessee for Michelin. And we put together a new program called Sound Bites that again gets debuted tonight, where we mash up music, because Tennessee's got music like no one else, along with chefs. And so we have Felicia will be joining us, and her restaurant is being spotlighted. That's also to lead to other, we want to promote all the great barbecue, all the great hot chicken, all the wonderful ways, as well as our white tablecloth restaurants.
Representative Hardaway, are you hungry yet?
Yes, sir. In fact, I'm going to ask him about the best barbecue. Does that include
Oh, you're going
the
to start a
Neely's?
fight.
I would need to look at, see what the 36 were represented out of Memphis to give you the exact who Michelin chose. Again, they have their blind tests that they send in people, but we know Tennessee's got a lot better barbecue than Kansas City.
Well, I know we do, and Memphis has the best, period. But Gina Neely is our local barbecue, I guess, ambassador. And she's a part of the celebration for Orange Mound. She's from Orange Mound on our 135th anniversary for the formation of the first community that's built by Black folks for Black folks. And I'd love to know that the department is taking a lead role with that.
Great. Thank you. We'll make sure that's happening.
That means I'd love to see you down there, sir.
Yes, sir.
That's a yes.
I'll try to see if we can be there. Yes, sir. I'm not sure when the event is, but absolutely. I'm in Memphis pretty regularly, whether it's civil rights or music or culinary.
So that's a yes.
We'll make every effort. Yes, sir. Don't know the date.
Thank you, Mr. Chairman, and the whole committee is invited down for barbecue.
Representative Parkinson, you're next up, sir.
Thank you, Mr. Chair. I just want to commend the commissioner and his team on the work that they're doing. I witnessed it firsthand, and I truly appreciate, the direction that you're taking us as a state, and also how innovative and creative you are in working working through these strategies that will increase tourism. I know we're one of the best states when it comes to generating tourism. I think I think that you are the best person to be in this space right now for us. So I truly appreciate you and your team, your whole team. And I just want to say that publicly.
Thank you, sir. On behalf of our team, thank you.
Absolutely. Tennessee is a destination. Representative McKenzie, I've got you next on my list, sir.
Thank you, Mr. Chair, and thank you to Commissioner. I'm sorry that I missed you when you were there in East Tennessee. I had a prior engagement and wasn't able to make it, but I hear great things about what you said and the work that's going on in the hospitality, tourism business in East Tennessee. But I also like to again thank you. I saw where I guess that was last week. You're adding to the civil rights tour. I know we were able to go down to Montgomery, which is kind of the gold standard as relates to the civil rights tour. But we're growing, we're adding, and I appreciate you committing to that with your words a year or so ago, but also with your deeds as you've been building that program. So just want to thank you for that.
Thank you, sir.
Thank you, Representative. Follow up, Representative Hardaway.
Thank you, Mr. Chairman. Getting on a more technical course here. Is the department developing any type of economic impact report for the past few months and perhaps this year going forward?
Yes, sir. It's we love talking about our visitor spending that tourism economics does. Tennessee, because of your support, Governor Lee, and a great industry, we are the second fastest growing state in America the last 6 years in visitor spending, up about $7 billion. That translates to about $600 million. And we got the Department of Leisure and Hospitality that is able to bring us those tax reports for restaurants, eating and drinking, lodging, hotel, and short term, and then our amusements and attractions. Fortunately, we're up 36%. The national average over the 6 years is 17, and it really speaks to the great assets. We don't have a beach and we don't have casinos. After that, we've got so many great things for people to come, our outdoors, our music. So yes, sir, we are very heavy into the data, and those are released each year, and we release both the leisure and hospitality from the Department of Revenue and our tourism economics, but that report won't be out for 2025 until July.
All right, Mr. Chairman, I'll be getting with you to see if we can't get some type of supplementary reports with the other matters that are going on in Memphis, Shelby County. We've got any number of small businesses, restaurants, and hotels who are being strained financially. And I don't think it's something that can wait until July. So I ask if you prioritize that and help to develop a strategy so that we can keep these businesses afloat until they can catch on again.
Absolutely. We enjoy working with Kevin Kane and Regina. We meet with them or talk with them just about every month as we try to work on strategies for them. We care a lot about their businesses.
Any further questions for the commissioner at this time? Seeing none. Commissioner Ezell, thanks for being here once more.
Thank you.
We're back into session. 10 minutes left, sports fans. We've got the questions being called. Clerk, please bring up the vote on the screen. Has everyone taken their vote? Clerk, please take the vote.
Mr. Chairman, you have 14 ayes and 0 nays.
Bill moves out to calendar and rules. Item number 6 on the calendar, House Bill 1583, Interstate Compact for the Supervision of Adult Offenders. We've got a motion.
Second.
And a second. Chairman Lafferty, you're recognized on the bill, sir.
Thank you, Chairman. Members, this bill extends the Interstate Compact for the Supervision of Adult Offenders to 2034. They had their sunset hearing on September the 16th of 25, where a Q&A was reviewed, and this 8-year recommendation was given. We have representatives from the Department of Corrections here if the members wish to go out of session to hear from them. Otherwise, I would appreciate your vote.
We've got the questions been called on the bill, and then we've got a person wanting to ask a question. Withdrawn. Representative Hardaway?
Yes, Mr. Chairman. I asked for these, not just number 6, but also number 7. And I believe the department is ready to put some things on the record.
Okay, at this time, we'll go out of session to hear from the department. Please recognize yourselves for the record.
Good morning, committee. Ashley Fuquay, Legislative Director, Tennessee Department of Correction.
Representative Hardaway, please ask your question.
Thank you, Chairman.
I apologize.
Thank you for that even more, Chairman. And good morning, ma'am. We talked about the questions I had and just giving you the floor. It's about accountability. It's about the actual effectiveness of the interstate compact for the supervision of adult offenders. And Mr. Chairman, if you give her a little leeway, she might wander into number 7 now and then. And that means I wouldn't have to ask her anything when number 7 comes up.
Please go ahead.
Okay, thank you. Thank you, Representative Hardaway. You and I spoke last week a little bit about this, but really some of your questions were more relative to domestic violence or courses or programs that might be recommended for these offenders. So just to tell you a little bit about what this compact does. So the Interstate Compact for the Supervision of Adult Offenders is a statutory mechanism. It's found in Tennessee Code Annotated 4028-401 that allows for the supervision of adult offenders in Tennessee. So Tennessee is, all 50 states are members of this compact. Also, you have the Virgin Islands, Puerto Rico, District of Columbia. Tennessee joined the compact in 2002. And really what the compact itself does is regulates the movement of individuals on probation and parole between states, ensuring consistent supervision, which enhances public safety and accountability. So under this compact, Tennessee has the ability to transfer individuals on probation and parole to all 50 states. So something you think of when you're thinking of this compact, maybe you committed an offense in Tennessee, but you live in Kentucky. This compact would allow you then to be supervised in the state you live rather than the state where you had that offense. Relative to your questions about some evidence-based programming or courses. Now, the department itself is not the individual that is recommending these courses. That when you're on probation or parole, right? Probation is in lieu of incarceration. Parole means you were incarcerated, but you were released on parole. The judge would be the person that orders that programming. If you, as an individual under this compact, had been recommended to take part in programming or a class, then the probation and parole officers would monitor that as a part of the special conditions ordered by the court. So whether it's, you're checking in person, they would make sure that you were attending those courses. Now, Tennessee and these other, the other states, if we would receive notification of a supervised individual that was transferred under this compact and they weren't, doing that, then we could register a violation and then pursue extradition. But a receiving state itself doesn't have the ability to revoke probation or parole pursuant to this compact. However, we would still monitor to make sure the special conditions ordered by the court were being met by the individual.
Yeah.
Under the compact.
Thank you for that. Representative Hardaway, have we covered your concerns yet?
Yes, sir. She touched on everything.
Okay. Thank you. Any further questions? Seeing none, we'll go back into session. Any further questions for the chairman? Seeing none, clerk, please open the board for the vote. Committees, please cast your vote. Anyone would like to change their vote? Clerk, please take the vote.
Mr. Chairman, you have 13 ayes and 0 nays.
Bill moves out to calendar and rules. Members, item number 7, House Bill 1595, Sex Offender Treatment Board. We've got a motion and a second. Chairman, go ahead.
Thank you, Chairman. Members, this bill extends the Sex Offender Treatment Board until 2034. They had their sunset hearing on September 16th of 25, where the Q&A was reviewed and this 8-year recommendation was given. We have representatives here if we wish to go out of session. Otherwise, I'd appreciate your vote.
At this time, we will go out of session. Please introduce yourself to the record one more time.
Yes, sir, Chairman. Ashley Fuquay, Legislative Director, Tennessee Department of Correction.
Representative Hardaway, please.
Thank you,
Go ahead.
Chairman. And having spoke, if you would give us an overview of some of the matters that we spoke on that I wanted on the record.
Okay, yes, sir. Happy to do that, Representative Hardaway. So again, the Sex Offender Treatment Board is administratively attached and housed within the Department of Correction. This is, again, a statutory mechanism that was created by the General Assembly found in Tennessee Code Annotated 3913-704. This was created in 1995 to address the growing sex offender population in the community. So the board itself is statutorily obligated to develop and prescribe standardized procedures for the consistent evaluation and identification of convicted sex offenders. This procedure provides for an evaluation and identification of the offender and recommended behavior management, monitoring, and treatment based upon, that we know that sex offenders are extremely habituated and there's not a cure for those. But what the board itself is doing, they're helping with those evaluations. They are setting standards for those evaluations. We do pay a reimbursement for clinical risk evaluations. And really looking to develop guidelines and standards for treating those sex offenders. So that could be those incarcerated and those on supervision.
Thank you, Ashley.
Yes, sir.
Representative, do you have any further questions?
Just one, how well are you working with the domestic violence advocacy groups?
Certainly. I mean, we're happy to reach out to any of those groups if they have questions about what we're doing for those sex offenders. You could have been convicted of a domestic crime and also then be a sex offender. Those are usually sexual offenses where you're then a registered sex offender or receiving treatment. But certainly if that's something that your domestic violence shelters want to, if you want us to reach out, we're happy to talk to them about what we could do to assist.
Representative Hardaway?
Thank you, Mr. Chairman. And these questions and our conversation, Mr. Chairman, was prompted by some of the domestic violence advocacy groups. So I'm going to be working more closely with you, and I'll be happy to make those introductions.
Okay. Yes, sir.
Thank you for the questions and the
Chairman.
comments. Oh, back out of session. Representative Fritz, we are at a 1-minute hard stop.
Thank you, Mr. Chairman. I'm going to speak really fastly. Thank you for your testimony. Just one thing I would offer, there is a cure for sexual offenders. We choose not to exercise it in Tennessee, unfortunately.
Thank
And,
you.
Thank you.
Back into session. Any further questions? Seeing none, clerk, please open the board for the vote. Has everyone voted? Anybody change your vote? Seeing none, clerk, please take the vote.
Mr. Chairman, you have 11 ayes and 1 nay.
Bill moves out to calendar and rules, and without objection, we stand adjourned.